Hello, my name's Marin Khalaf. I'm an ICU clinician or intensivist from the United States, and I'm the chairman for the Academy of Infection Management, also known as AIM. I'd like to spend a few moments introducing you to the objectives and principles of AIM as you have entered this website. The Academy of Infection Management, or AIM, is a not-for-profit company that is registered in the United Kingdom. AIM consists of an executive board of 4 of the world's leading clinicians in infectious diseases, including Phil Barry from the United States, Tobias Welty from Germany, and Bob Masterton from the United Kingdom. AIM also has an executive board that is further supported by a global faculty of expert clinicians in infectious diseases and other specialties who represent all continents globally. In terms of the main concepts and objectives for AIM, it's important to recognize that antimicrobial therapy of serious infections is an important determinant of outcome. Appropriate initial antibiotic therapy, meaning an antibiotic regimen that is active against the organism causing the infection, is one of the most important determinants of outcome for the patient. The objectives of AIM are really to provide global education regarding infectious diseases for clinicians, surgeons, chest specialists, and microbiologists, as well as to share the best clinical practices regarding the diagnosis and management of infectious diseases. AIM also wants to share the latest clinical and scientific data available regarding the management of these infections. And this also includes the availability of new antimicrobial agents, as well as new technologies that are available for the diagnosis of serious infections. Let me just go over some of the core principles for AIM. Really, the most important core principle is to try to optimize the outcome of the patients that we care for. Obviously, for patients who have serious infections, appropriate initial antibiotic therapy is really one of the key core principles. We know from many studies that have been done over the past 20 years that when patients receive appropriate initial antibiotic therapy, meaning an antibiotic regimen that is active against the pathogen causing the infection, their clinical outcomes are improved. This, therefore, has an impact on antimicrobial choices. It's important to keep in mind that we want to use an appropriate initial antibiotic regimen based on the patient's risk factor profile. For patients who have nosocomial infections, such as a hospital-acquired infection, one needs to be aware of the prevailing pathogens and their susceptibility patterns when making those types of decisions. Not only is the right antibiotic selection important, but the dose of the antibiotic is also a clinically important variable. For critically ill patients, we know that they often have large volumes of distribution that can impact the concentration of the antibiotic, as well as augmented renal clearance. Therefore, optimizing the dosing of the antibiotic can be important in terms of determining clinical outcome. And finally, it's important to recognize the pathogens that are available in your local environment. Clinicians should tailor antibiotic regimens against the prevailing pathogens and their resistance patterns. Another important AIM core principle is antimicrobial resistance. It's important for clinicians to recognize the presence of antibiotic resistance and the patterns of resistance that are present in the microorganisms accounting for infections in their local hospitals. This is key in terms of making decisions regarding the initial empiric antibiotic regimen. Another important core principle of AIM is infection control. Infection control is key from the standpoint of minimizing the occurrence of additional nosocomial infections and preventing the horizontal transmission of antibiotic-resistant pathogens. These infection control principles include basic ones, such as hand washing and the use of gowns and gloves to minimize horizontal transmission of resistant bugs, as well as removing indwelling vascular catheters to also minimize the occurrence of these types of infections. It is the hope of the AIM faculty that we will be able to further develop opportunities for interaction with clinicians on a global basis. This will include educational activities available on the AIM website, as well as other educational activities at the local level.